Hello everyone, I am Dr. Loveleena Nadir and I am a senior consultant at Rosewalk Hospital at Panchsheel Park. You know, pregnancy is a period of sheer joy and happiness, but of much anxiety. But expert doctors can make your journey smooth. So today I am going to talk about high-risk pregnancy. Now, high-risk pregnancy is one in which there are increased risk of complications before and during pregnancy and also after delivery. But you know, certain pre-existing conditions can also complicate pregnancy, like hypertension, existing hypertension in a patient, diabetes, anemia, epilepsy. It could be rhesus blood group incompatibility, somebody who's using alcohol, smoking. Everything increases the risk of complications. And then a history, a bad obstetric history during previous pregnancies, like history of chromosomal abnormalities in the child or multiple abortions. So everything, has a role to play, and this can increase the risk. But nothing to worry. If you see your doctor, everything can be taken care of. So pre-conception counseling really helps in tackling all these existing conditions, and of course lifestyle modifications like paying attention to your diet and getting to an ideal weight before you start pregnancy makes the pregnancy journey more smooth. But there are certain conditions which can develop during pregnancy, like it could be hypertension during pregnancy. We call it pregnancy-induced hypertension. It can be gestational diabetes, means diabetes which has come during pregnancy. But sometimes it could be thyroid levels are fluctuating and patients don't even know. It's an incidental finding in pregnancy, and as we do a routine ultrasound we can find fibroids during pregnancy, or it can be a low-lying placenta, multiple births, amniotic fluid variations. Sometimes the fluid is more, we call it hydramnios. Sometimes the fluid is less and we call it oligohydramnios. It could be intrauterine growth retardation. So all these factors also increases the risk of complication during pregnancy. But a multidisciplinary care by a team of expert doctors will take care of everything, and it's really a good idea to fix your appointment with your favorite gynecologist so that the risk of complications is less and your journey to motherhood is happy. And you should be well informed, well prepared, well protected, and that is why these small tips for you. And there is one more apprehension in patients' mind, whether they can have a normal delivery with all these complications. Yes, if we take care of them and with expert guidance, you can still deliver normally, and cesarean is not the rule. So you and your doctor will have to work together to achieve a normal delivery and a healthy baby. Thank you.